began by talking about cardiac glycosides. So this is the major drugs that is used in the treatment of heart failure. So cardiac glycosides are also used to correct atrial fibrillation. Atrial fibrillation. Cardiac glycosides are also used to correct atrial fibrillation, that is, cardiac dysrhythmias. Cardiac dysrhythmias. I missed H there. Sorry, and an H there. With rapid, uncoordinated contractions. So contractions of atrial myocardium. So from the name, you know that this is a problem with the atrium. The cardiac glycoside can also be used to correct atrial fibrillation, which is what cardiac dysrhythmias. So all of these are called they fall under the word dysrhythmias. Cardiac dysrhythmia with rapid, uncoordinated contractions of the atrial myocardium. Right? That is one. And atrial flutter this is different from fibrillation. Atrial flutter, which is cardiac dysrhythmia with rapid contractions of 200 to 300 beats per minute. No, this is not normal.
Yes.
Abnormal. Normally, how many beats should a person have per minute? Huh?
200 beats per minute.
Average 70, 75, right? Let's say 72 beats per minute. So imagine a person having up to 200 to 300 for the atrium, 200 to 300 beats per minute. So we'll call it, that is a flutter. Cardiac atrial flutter. Now, you see a type of what? Cardiac dysrhythmias. Right? So we have fibrillation. So this one will be stronger than this one. This one is lighter, but much more rapid. Whereas this one is probably more stronger, but uncoordinated. So beyond the normal range of what heartbeats for a normal human being. So it's used for those two. Why is it possible? Why can we do this? Because of what? The negative chronotropic effect and negative dromotropic effect of this. Besides this has what? They have a positive inotropic effect. So this is one of the things we need for heart failure. The heart should beat stronger, right? As a negative chronotropic effect and what? Negative dromotropic effect. So this one, decrease in conduction, right?
Yes.
This one, heart rate. So these are two problems, some of the problems here that also that cardiac glycoside will correct, right? So that. Okay, moving on from that. The next point I want to discuss in my notes is what I call titled non-pharmacologic measures. Non-pharmacologic measures to treat heart failure. Non-pharmacologic measures to treat heart failure. 1. The client should limit salt intake to 2 grams daily, that is 1 teaspoon. So reduce salt intake to 2 grams daily or 1 teaspoon. You know, we can have many size, but teaspoons usually have around the same size. So whether you have teaspoon, not spoon, right? So we want to reduce salt intake to like 2 grams daily because salt would allow us water to be held up in the body. Secondly, alcohol intake should be either decreased to 1 drink per day or avoided. So second one what? Reduce or eliminate alcohol intake. You know, for some of us, this might be a problem. You might not take the actual alcohol, but you might consume foods or beverages rich in alcohol. Alright, so those ones you might need to be knocked off your table. Because once you contain alcohol, it actually contains alcohol. So alcohol intake must be reduced. The third point is that what? You need to reduce smoking. Smoking should be avoided. Actually, smoking should be White London, Rothmans, Benson, sorry, if you are the marketer of those companies. Smoking of all types should be reduced because it deprives the heart of oxygen. Number 4, obesity increases cardiovascular problems. Obese clients should decrease fat and calorie intake. So, obese clients will need to work on their weight or their fat profile, right? So, obese clients would need to work on their weight and then fat profile. Especially bad cholesterol that needs to be reduced because of the heart, and so obesity would exacerbate CVS problems. So this needs to be done. The third one, the fifth one here, if I'm right, mild exercise such as walking. Mild exercise is encouraged. Mild exercise is encouraged. So most of these things are lifestyle changes. Reduction in salt intake, avoid alcohol, avoid smoking, maintain a normal body weight, reduce fats in the body, then exercise. The person might need to have at least some activity, some active lifestyle is maintained. Now, to talk about one of the drugs here, to talk about digoxin, also known as lanosine. Digoxin. I'm going to partition this correct. Digoxin. Now, this drug, pharmacokinetics here, said absorption rate of oral tablets form is greater than 70%. So, absorption of oral tabs is greater than 70%. So, no, this is pharmacokinetics, right? Pharmacokinetics of the drugs greater than 70%. The rate is 90% for liquid. So liquid is better here. Liquid is 90%. 90% for liquid. And 90 to 100% in capsules, in capsule form. So you see why some drugs are capsulated or encapsulated and not just given there. Oral tablets, just bear tablets 7%, liquid up to 90%, capsules up to 100%. So protein binding is low, half-life is 36 hours. So we have what? Low protein binding, half-life says all like 36 hours. So this is more than a day. 36 hours. So you know that with this, if you give this drug every day, there can be bioaccumulation of drugs, drug accumulation. Do you understand? Yes, and we said that before you achieve the steady state concentration of this drug, you need to have gone via 4 to 5 half-lives. Right? So if you do 4 times 36 hours, that's like how much is that? 4 or 5 times 36, 150, 180. That's like 180 hours. That's like almost 8 days. 8 days, almost 8 days. Like 7 to 8 days to achieve the steady state concentration for this drug, 4 to 5 half-life. Alright? So we said that half-life is at 6 hours. Now, 30% of digoxin is metabolized by the liver and 70% is excreted by the kidney. So 30% metabolized by liver and 70% excreted in or via the kidneys. Via the kidneys there, mostly unchanged. So if it's going mostly unchanged, if it went to the liver, it should be changed. So if it's going to the kidney, mostly it is unchanged. Note, kidney dysfunction can affect the excretion of digoxin. Kidney dysfunction, I think we've explained this before, that if once a patient has suboptimal kidney function, the kinetics of that drug will be affected. Do you understand? So, in heart failure, one of the problems the person has was a suboptimal kidney function. The kidney is not at the peak level again. So, meaning that if when the half-life might begin at 6 hours, or the drug might stay longer than what it should, because most of the time, I'm saying that kidney dysfunction can affect the excretion of digoxin, while thyroid dysfunction can alter the metabolism of cardiac glycosides. Please wait more. So, kidney dysfunction can affect the excretion of this drug, digoxin. Whereas what? Thyroid dysfunction can affect the overall metabolism of cardiac glycoside. Those should be decreased in hypothyroidism. Those should be decreased in hypothyroidism and vice versa. You get it? So, you might, because of the kidney function, you might also look at how the excretion is done. If thyroid function went up, you might need to increase the dose. Now, if there is hypothyroidism, you might need to decrease the dose too, because the drug will stay longer. So that is for digoxin. Briefly on digoxin, I didn't mention the dosage for administration. The next one to talk about is digitoxin. Digitoxin. Now, so digitoxin itself is a potent cardiac glycoside that has a very long half-life and is highly protein bound. So this drug is seldom prescribed. So digitoxin has a very long half-life. You said it is potent. One. Long half-life. Even highly bound to proteins, and is seldomly prescribed. Seldom prescribed as at this point. The names digoxin and digitoxin are very, very similar. They are very, very similar. Caution is required in the administration of the correct drug. So digoxin must be differentiated from digitoxin. So this one has even a longer half-life than this one. So that's why if it has a longer half-life, it must be highly bound to protein. The more than the other one, then seldomly prescribed. Okay. The client should be advised to take the same brand of digoxin. Now this will come under nursing responsibility, that you ask the patient to take the same brand, not just to switch, because at times there can be differences in the formulation by the different manufacturers at times. So the client should be advised to take the same brand of digoxin to avoid unnecessary side effects or adverse reaction. So this is just for pharmacokinetics. Quickly, I'll talk about the pharmacodynamics. Pharmacodynamics of this drug. Okay, I think I just started up here. Pharmacodynamics of this, right? Pharmacodynamics pharmacodynamics of this drug that inclines with a failing heart, cardiac glycoside increases myocardial infarction, myocardial contraction, increase in myocardial contraction. This is one of the reasons why we're using the drug, to have an increase in what? Myocardial contraction. Okay? Which would increase, this would increase cardiac output. This one would increase cardiac output, and improve circulation and tissue perfusion. Right? We need more blood to get to organs and other important tissues. So because this drug decrease conduction, so we already said before that they decrease conduction through the AV node, heart rate decreases. Heart rate would do what? Would decrease. Heart rate decreases. Okay? Heart rate decreases. So, therapeutic SAM level. Please pause that video. Pause. Can you